When there is uncertainty, public health is more important than ever. We bring systematic methods, order, evidence, and reason to uncertainty in order to find answers and improve the public's health. Our professional compasses let us navigate uncertainty without getting lost. Ethics, evidence, and reason are our true north, and that's reassuring. We in public health can be the ones shaping, driving, leading, and convening broader public conversations about health, the environment, and other topics. We can ask important questions and do the vital research that otherwise might not get done. It's our jobs to be curious, practical problem solvers. We should approach issues from a nonpartisan perspective, letting science, data, and facts inform and shape discussions, but with openness and empathy. In times of uncertainty, we may be pessimistic about the present, but we should be optimistic about the future. Knowledge will win over doubt, and paraphrasing the great astronomer Carl Sagan, science can be a candle in the dark.
In a way, there's never been a time of certainty anywhere on the globe. It may be that we have more certainty nowadays than we have had ever since humans began to walk the face of the globe. One of the drivers of uncertainty is that we know more. We know more quickly, and yet the pace at which we understand problems, both old and emergent, hasn't changed that much. What public health brings to the table is its inherent interdisciplinarity. It requires multiple looks from multiple perspectives, not just microbiology, not just mathematics, but the social sciences, the political sciences, the humanities, all need to be brought to bear to provide new solutions, new hypotheses that can be tested, and new ways of addressing old and seemingly intractable problems.
I think this ultimately gets back to what public health does. Public health is about creating the social, economic, political, cultural conditions that make people healthy. Now, academic public health does this in three ways. We generate the knowledge. We generate the knowledge that informs the political, cultural, economic conversation. We train the next generation of students to know how to use that knowledge. But we also engage. We also engage in translating our knowledge, making sure our knowledge doesn't just sit on the shelf, and we engage in the broader political, economic, cultural conversation. Now, in times when there is national leadership, global leadership, that is moving the world in a direction, that is creating policies that promote health, in some respects, public health can almost take a step back, take a role that supports generating the data, training students, and make sure that those who are making decisions informed by what's right for populations have the right available data. I think in other times, and more troubling times like the ones we're in right now, academic public health has a more assertive role to play. I think we have a role to play always continuing to generate knowledge, always continuing to educate the next generation of students, but also taking the step to make sure that our work is clearly widely accessible, making sure that the broader conversation is aware of what it takes, what we need to do collectively to generate health, and what we are doing that might be harming health today and 10 years from now. I think that's why academic public health has a role to play now more than ever.
So in challenging times, the role of academic public health as a voice for public health becomes absolutely essential, because we may be the only place that feels comfortable expressing that voice. And in particular, the way we train our students to feel confident and competent to express what they know is right and correct and important for societies becomes critically important. So academic public health, I think, plays a more important role in times like these than in any other.
And I think for a lot of us here in Texas, we've had Republicans in every statewide office for the last 20 years. And so I think our approach tends to be a bit different than a lot of the schools on the East and West Coast. But we've been very successful. The legislature has appropriated money that goes to our school for Healthy South Texas. And this is to reduce diabetes, asthma, and infectious disease along the border between Texas and Mexico. And really, we made the business case to them. You know, how do you reduce the cost of health care? How do you improve lives? How do you have a vital economic community? And really, our legislature has been extremely supportive of that. We've also found allies throughout the state. One of our strongest supporters is Trammell Crow. He is a wealthy businessman from the Dallas area who runs Earth Day Texas, and he is outspoken as being a green Republican. So we found a link with him in saying that you cannot separate businesses from the environment, and together they're going to create a vital economic community. So really here in Texas, I think we take a very different approach. We say that you cannot split public health, environmental health, and a vital economy, and together they make us really the strongest we can be. So for us, there really hasn't been that much of a change. I think we keep doing what we do. We work in Texas, which is the second largest state in America, and we really can make a difference and make a healthy state for everyone.
Academic public health has a sacred trust, now more than ever. Public health programs are under assault. Health insurance for our nation is under assault. If we are going to be the only developed country in the world that does not insure its population, if public health people don't speak up, who will? Academic public health produces research that determines what interventions save lives, and we train the next generation of practitioners. This sacred trust has to be activated, meaning we have to speak out, we have to step up, because if we don't do so, who will? And we have to train a generation of young people who will go on caring and go on fighting.
As a public health leader, I've been asked that question a lot recently. And as you might imagine, this is a reflection of the many events that have happened around the country, the divisiveness that many people have experienced or witnessed. And these are all in direct contradiction with the field of public health values. And the field in general has been built on diversity, inclusion, and the need to work together towards improving population health. So from my perspective, the role of public health doesn't necessarily need to be evolving, but rather we have to commit towards action. And that means embracing the diversity of the we've been built on, and then identifying universal problems, identifying evidence-based strategies for those problems, and then developing and creating environments and systems that support the enaction of these solutions.
The current political climate seems to be a little bit hostile to scientific evidence. We also have a challenge around the field of prevention. Prevention is a bit invisible. If you accomplish the prevention of something, you don't really see the evidence. Whereas curative medicine, it's very evident. Someone is sick, they get care, they either get cured or they get managed, and this is where people seem to want to invest their money. Meanwhile, those of us in public health realize that public health investments can save a lot of money in the long run. One of the reasons that European countries have lower healthcare costs is that they invest more actively in prevention and avoid expenditures on the cure side because people didn't get sick to begin with. So we feel that educating the average American about the value of prevention and what kind of investments need to be made to avoid human illness, and also taking a look at the key issues of the day, looking at what can be beneficial for people, what can be harmful for people, and making it clear to people exactly what those are in a way that it doesn't have jargon, doesn't have complex scientific language, that's something that everyone can understand. So in my view, these are great challenges for academic public health.
We are living in a time of great uncertainty, but also a time of immense opportunity. As a global community, we have halved the number of child deaths around the world. We still, though, have so far to go, with 100,000 needless deaths in the United States every year and millions more globally. Here at the Fielding School, we're ready to roll up our sleeves, and we work together across every aspect of our community to do that. We have faculty working reducing cholera worldwide, faculty in the DRC working on Ebola, students making sure that California farm workers are less exposed to pesticide. Key to what we can do as academic public health is make sure that the evidence leads to impact and changes the quality of each of our lives and the health of all of our communities. That translation from world-class research to deep impact is at the core of our mission.
The time will come as scientists, as public health researchers, that there's a little more room for advocacy now than maybe we felt comfortable with overall. I think that now, as some of the public health advances are being challenged, we need to step up, have our voices heard by policymakers in the state, federally, and internationally, and make sure that not only are our public health advances not turned back, but that we continue to make the progress in reducing health disparities, reducing the health impacts of climate change and environmental change, and that we look forward to a time when more people can have greater life expectancy, quality of life, and enjoy safe workplaces, safe environments, and safe places to raise their children. One of the most partisan issues right now has become issues related to access to affordable health care. I think in this area, we have to be really cognizant of the role of public health in advocating for the most susceptible populations and thinking about how to make sure that we have access to high quality health care, that our systems evolve to a place where we can solve these problems and move forward and not move backward in increasing access to high quality care, high quality preventive health care, high quality public health services.
When there's uncertainty, people often are concerned and frightened, and it's easy for society and government to lose their way. What we do in public health is measure disease in populations, measure absence of health in populations, and then look at the risk factors and design interventions to improve the health of populations. So I believe that what we should be doing now in this time of great uncertainty is pointing out what the problems are in society, how to improve the health of everyone in society, and then devise interventions to make that a reality. I believe that our mission always, but especially in times of uncertainty, is to generate evidence, to look at the health of people and populations, and devise interventions that make populations healthier. And then, in times of uncertainty, to take that evidence and take it off the shelf and move it into action, to be advocates for change that we know must happen. And many times, decision makers want to do the right thing. The people want to do the right thing, but they're not sure what the right thing is. It's our job to point out what the right thing is and to help them get there. So I view public health, academic public health, as sort of a compass. You can think of times of uncertainty as when you're walking through the forest and things are foggy, it's not clear where to go, and we're a compass that points the way to make the right decisions to improve the health of everyone in a population.
Public health as a discipline works to understand those factors that help to keep people healthy, and we use that information to develop programs and inform policies to keep our communities healthy. In this time of uncertainty, we need to be advocates for the community, be the voice that helps them and helps our leadership understand the importance of public health and the whole role of prevention in our communities. Now more than ever, it's so important that our leadership understands the importance of funding these programs and the agencies that help to ensure the public's health. I have many students, many faculty in my academic discipline wondering about the future of public health. Where will funding be? Will we be able to keep the population healthy? And we need to be certain at this point that we are here to advocate for this discipline, advocate for the population and for the community. We have issues that relate to people that are marginalized, disadvantaged, and it is our goal and our mission to help to ensure their health as well as the health of the greater community.
It does seem like public health as a profession and as a practice is actually designed to deal with uncertainty. Public health professionals, when they appear in the midst of an epidemic or a natural disaster or a man-made disaster, are in a situation of uncertainty. So I think we as public health professionals are probably best suited than most professions to deal with uncertainty. The worst thing that public health can do is succumb to these challenges, be they a reflection of the political environment or historical circumstances. If we assume that we are currently living through a period of challenge, not unlike perhaps a period of war against some of the premises of what we believe to be the framework of public health, then we need to confront it as such. We at any time as public health professionals can be confronted with disasters of war, so let us think smart. Let us think of how we would engage a situation of war, how we would identify existing resources, and how we could recruit them towards solutions. Communities, individuals, families, and populations rely on us. The last thing we want to do is to appear as victims. We are a solution. Let's be that.
Well, I like the concept of uncertainty, but I also want to think of things in terms of really change and proposed change. And what does that mean? Sometimes the change is something that some of us don't feel will be beneficial to public health or to people in their lives. And so how do we really have an impact to make sure that either the change is not occurring or that we can change things in a way that will help people in population or public health? And when I use those terms, I really mean people's physical, mental, emotional well-being. It's not one definition. It's very all-encompassing of people in their lives. And we're pretty fortunate in the US because I think we do have checks and balances. But despite that, it doesn't mean that we can't be negatively impacted or people's health can't be negatively impacted by certain decisions that are made, political or otherwise. So I see one of the great opportunities is working at the local level, the community level. We established the Western Massachusetts Health Equity Network. Bringing more people together to have a bigger voice is just so critical. In the same way that our chancellor signed we're in for the Paris Climate Agreement with about 1,200 other leaders in academia, mayors, etc. So how do we have a bigger voice? And I think that's always the key for all social issues, whether it's public health or other things.
One of our values here at Berkeley is impact first. And what does that mean in terms of how public health contributes a different perspective to the national health debates? In clinical medicine, what we have to do is to show that a treatment is a little bit better than the alternative treatment. It doesn't say anything about whether it's worth it or not. But if we think about impact at the level of the whole population, then what matters is whether our investments are producing real change across an entire population of Americans. And those questions can't be answered just by knowing whether something's a little bit better. You have to know whether it's better and worth it. That's the perspective that public health brings. We're engaged in a fierce debate right now about how to restructure our healthcare system. And there's lots of disagreements about how to accomplish that. But I think there's wide consensus that we want to make sure that every American has the right to be healthy. We embody that here at the school in our core value, health as a right. While we debate about how to accomplish health as a right, one of the things that public health contributes is measuring health not just in terms of whether we can cure a disease, but rather what does it take to keep a population healthy? That's the perspective that public health brings to this debate. And that creates a different set of priorities for how we restructure a healthcare system.
So the first thing public health can do in times of uncertainty is to continue to do something that public health has always done, and that is to reveal the truth about what drives population health. And we can do that through precise description and through rigorous research. Research that looks at the range of factors that affect health, ranging from biology and genetics all the way to societal factors. And of course, to communicate that description and that research in ways that are compelling and clear so that we as a society can use that evidence to really identify what things we should be doing to promote health and health equity. And the second thing that public health can do in times of uncertainty, which is as important, if not more important than the first thing, is to continue to advocate in a compelling way for health as a human right, and also to reveal through research and through actions and practice the critical role of social justice to health.
We are facing new challenges and uncertainties, but that is what public health is about. It's about fighting for social justice, fighting for universal access to health care, fighting for a better environment. And to do so, we need to have a truly global approach, linking domestic and international issues and finding solutions together. Public health is thriving when there is a challenge, and public health will be highly visible in the years to come.
I think we have to be clear in thinking about where public health is going and really where the planet is going, because the paradigm of public health practice goes back 100 years when the cities were drowning in their own filth. And public health was instrumental in identifying the problem and then ultimately in partnering with politicians and with engineers to create the water and sewer systems that made cities safe. The filth of current times is carbon. And so I think as we partnered with engineers, we have to find out again how to speak with economists and politicians about this new challenge, the climate change. We do not yet have a language in academic public health that allows us to enter the space where we're talking about tax policy, sustainable economics, spreading wealth, but I think we have to acquire that voice and acquire that expertise and make those partnerships.
In public health, we operate under the premise that wellness as health is a fundamental human right. Life is full of uncertainty. In fact, it is the unpredictability of our world that makes it so fascinating and is what drives us in public health. We work hard every day in this field, parsing problems to find answers and solutions at an accelerated pace. We research and teach to affect positive change in our communities through interventions at all levels. Our research makes discoveries that are translated to benefit the health of populations and ultimately serve those who need the most support. At Temple College, we think across academic boundaries to explore the connectivity of social, biological, environmental, and cultural elements of health and wellness. This collaboration results in a broad understanding of the issues to provide a robust set of solutions. It is truly an honor what we do in these uncertain times.
Approaching the most important public health problems and improving the health of populations is inherently political. It's an exercise in determining what can be done by bringing people together from communities, from political parties, to approach these problems in the most effective way. Those of us in academic public health should be leaders, both in terms of providing new information through research, educating the thousands of students that we have, and importantly also in advocacy, telling the public about those important public health problems and the solutions that we see toward them. So defining public health solutions is more than about partisan politics. There will always be partisan disagreements on various types of solutions, but we have to work the best we can within the frameworks and the partners we can find to approach these problems.
During times of uncertainty like these, public health steps into the spotlight. Public health embraces the challenge of ensuring that those without the time or the voice or the resources to advocate for their own needs will still get their needs met. When we identify food deserts in an urban area and advocate for access to fresh fruits and vegetables, we are saying to the residents of those neighborhoods, we see you and we are here for you. When we develop programs to help people with diabetes take care of themselves and avoid visits to emergency rooms, we are saying to those individuals and their families, we see you and we are here for you. When we develop evidence-based programs to help the elderly stay in their homes and maintain their quality of life, We are saying, we see you and we are here for you. Public health fills the gaps that would otherwise become worse during challenging times. We do this by assessing needs, by providing quality programs and services to protect our population's health, and by shaping policies to ensure that the members of our society can live long, healthy lives. We are public health. We see you and we are here for you.
Public health needs to embrace what we know already, that actions to improve population health are intersectoral. And for that reason, community ownership, not just participation, but ownership is critical. The same way medicine is evolving into what we call now patient-centered care, public health needs to embrace a community-centered approach. We in public health can continue to act as if we were the only ones that understand what are the health problems in a community, and that we know what individuals and communities need to do to solve these problems. The community needs to take the lead on determining what problems need to be solved and what the solutions will need to be. And often that will be highly controversial. Some of them will be politically controversial or otherwise. We do have in public health the technical expertise into helping the diagnosis with our surveys, our studies, population-based studies, and evaluation techniques, but the old style, top-down, know-it-all approach is not going to work anymore. We need to learn how to work better and communicate with scientists in other disciplines, with other sectors, and importantly, with other groups in society who have different political views than those that we hold. The development of new and sound methods for translational research or dissemination and implementation research are critical for the future of public health.
The role of academic public health, the over 100 schools and programs of public health throughout the country play a vital role in assuring the health of Americans and people throughout the world. Public health is essential to prevent illness, to avoid problems that otherwise would occur without the evidence-based approaches that academic public health programs develop and disseminate. What we've found is that public health adds years to people's life, but also prevents disability and problems that need not occur, and it requires a combination of educating the public and making sure that they know the role that they can play to assure their health, but perhaps even more important, to make sure that there are policies and systems in place that allow people to meet their full health potential. Many refer to this as a culture of health, and this culture of health will allow people to meet their full health potential, life expectancy, and get what they deserve in terms of a full life.
I think we have to be aggressive. I think we have to think hard about what the next generation is going to be facing with what changes have occurred. It is very clear that the public is frustrated with institutions that are very sacred in this country, whether you call it higher education or Congress or science. And I think our challenge is to make sure that we address those frustrations rather than sitting around and waiting for the status quo to come about. Public health is at that interesting intersection between sort of the academics of public health and the on-the-ground public health. We understand public health sort of from an academic perspective as well as the ugly underbelly of the country that was exposed during the elections. I think we have to change the discussion. We have to change the paradigm. We have to change the strategies that we think about when we want to address how do you address these changes in the country. Having a conversation and trying to protect population health when nobody understands what population health is, and certainly the public doesn't understand and doesn't care about it, really is the wrong kind of conversation to have. But I do think public health, both academic and professional, has a responsibility to sit down and think about what the future is going to look like in a way that is different than it is right now. We have to preserve some of the most important institutions that make up our democracy, voting rights and education, and we can do that through the lens of public health.